Well, thank you very much, Joel, for the introduction, and thank you to Sarah for co-presenting today. I'm very excited to be discussing a new initiative that is being led by Sarah and her team and my dear colleague, Dr. Amanda Maestre at the Universidad de Antioquia in Medellin, Colombia. That part of that work, which Sarah will present, is building on some of the research projects that Amanda and I have led over many years in trying to study the effects of malaria in pregnant women. So for my part of this presentation, I want to just give you all a little bit of background about our collaboration and really to highlight how these partnerships can become so important scientifically, personally as well, and also lead to these much larger programs in public health that we're very excited to look to in the near future with this initiative. So my colleague Amanda is on this call. She's here in this photo with her students. Many of these students have actually spent time here at the U of A as graduate students. I'll be talking about work from Ileana, Olga, Catalina. Angie actually did her master's in the School of Public Health here as well. So we have these very strong ties, particularly with the student training component and also with our research program. So I'm not going to go into a lot of the details about the research. I just want to give you some very kind of general highlights about what research we've been working towards over many years now. And really this collaboration with Amanda is one of those random beginnings where we were both in South Korea attending a malaria conference back in 2008. And we sat next to each other on the shuttle bus back to the hotel. And that really launched this whole research program that has been so pivotal for my own research here at the U of A. So as we sat on the bus and discussed, what do you work on? What do you work on? We realized that we had this real kind of alignment in our interest in studying the effects of malaria in pregnant women. And I'll say that it's still true today that most of the research on malaria in pregnancy is focused on populations in Africa. And that makes perfect sense. That's the continent with the greatest burden of disease. But malaria is also widespread in other tropical regions of the world, including South America. There's a lot of malaria still in Colombia, in Brazil, and other parts of South America. So we decided to collaborate and to develop research projects to study the effects of malaria in Colombia. And just as a little synopsis of how this evolved, we got our first grant from CIHR in 2010. This was a one-year catalyst grant to get our work off the ground. Our first Colombian PhD student, Ileana, who I'll show you another photo of her in a moment, she won an ELAP scholarship, which is the Emerging Leaders of the Americas program from the Canadian government, which has really been an instrumental program for us in terms of supporting both graduate and undergraduate students to spend time in our lab, and not just a few weeks. They come for 6 months. It's a real commitment. Often there's, some language proficiency that needs to be developed and on both sides, and a lot of research capacity building. And this has also really strengthened these partnerships. So Ileana was the first student to come over in 2011. Since then, we've had 2 other CIHR grants related to this work and an NIH grant. And I said we started off looking at malaria and pregnancy. Now we found ourselves looking at malaria vaccine development. And I'll just take you through that process a little bit. So with this ELAP program, we've trained 6 Colombian graduate students from Amanda's lab here at the U of A. Angie, as I said, she did her undergrad with Amanda and did her master's here in the School of Public Health. And we've published 16 papers together. And another one is currently being in preparation. So it's been a very productive and exciting partnership. So our work together has largely focused on these 4 areas of research on malaria. First of all, on the diagnosis of malaria in pregnancy. We've studied the immune responses to malaria infection in pregnancy. This led us really serendipitously to a project on vaccine design. And now we have a more recent project trying to improve the diagnosis of malaria in pregnancy by identifying host biomarkers that are associated with placental infection. So this is Amanda, and maybe she'll turn her video on later so you can see her on the call. And this is Ileana, the first PhD student who really has been instrumental in leading so much of the research work that I'll be talking about today. So the first project that we really started this collaboration about was on malaria diagnosis. We were developing molecular diagnostics for malaria. In Colombia, there's very high prevalence of submicroscopic infections. That means infections that you can't see by eye by looking under the microscope. You can only detect them with molecular diagnostics. So this was a perfect partnership where we were able to use these molecular diagnostics and apply them to samples that were collected in communities affected by malaria infection in pregnancy. And this was one of the first publications from our collaboration with Ileana leading this. And then this is just to highlight that the reason why molecular diagnostics are so important is that they can detect infections that would otherwise have been missed. And that's what's shown here. I don't know, I hope you can see my cursor. In this case, 20 infections from these pregnant women were detected by microscopy, but 130 were detected by molecular techniques. So these tools proved to be very important in describing the epidemiology of malaria in this community and identifying key research questions that we needed to address based on this undiscovered infection or level of infection. The second part of our research was saying, okay, these women are getting these submicroscopic infections. Why aren't they evolving to full-blown infections? Is there some immune control over these infections? And to look at this, we established, and this is with our CIHR funding, a longitudinal study of pregnant women in Colombia so we could follow them throughout pregnancy. We use these diagnostics to detect these infections throughout pregnancy, but then we also study their immune responses and characterize the birth outcomes from these pregnancies that were exposed to malaria. So we published quite a few papers relating to this work. One was understanding that these submicroscopic infections are probably not benign in pregnancy, and they're actually associated with anemia in these pregnant women. But by studying these immune responses, we stumbled onto some very interesting observations that then led us to see if we could use those findings to develop a new vaccine strategy to protect pregnant women from malaria. And without going into too much of the biology here, what we had observed in those studies in Colombia was that there seemed to be some immunological cross-reactivity with particular antigens from Plasmodium vivax and Plasmodium falciparum. So one of the advantages or the attractions of studying malaria in Colombia is that unlike in most parts of Africa where women are only infected with Plasmodium falciparum, in Colombia there's about equal proportions of two species, falciparum and vivax. And what we observed through these studies with our collaboration with Amanda is that it appeared that a prior exposure with Plasmodium vivax might prime the immune system in a way that could be protective against falciparum infection in pregnancy. So we're interested in the immunology that's underpinning these observations, but also thinking about if we could identify those key antigens from vivax, could we exploit these in vaccine design? And that's the focus of our work that's ongoing at the moment, is to try to see how we could identify vaccine candidates to stimulate this protective antibodies against malaria parasite antigens. And the last part of the work is with another collaborator here at the U of A, Dr. Denise Hemmings, who's in obstetrics and gynecology. We have a very talented PhD student, Rebecca Reef, an undergraduate Kennedy, and we had a research associate, Melissa, who's now at the Institute of Parasitology at McGill, leading her own research group. But with this team and together with Amanda's group and with Ileana, we wanted to improve the diagnostics for malaria in pregnancy. One of the challenges is that when you diagnose, even with molecular methods, at delivery, you find that there are infections in the placenta that are not apparent if you simply diagnose a woman based on the blood in her periphery. So during the course of pregnancy, you can take blood samples from the finger prick or from the blood from the arm, and you can use these sophisticated molecular techniques and detect these low-level infections, but that still doesn't address the parasites or detect those parasites that are accumulating in the placenta. And ultimately, it's not until the woman delivers the baby and delivers the placenta that you test the blood from the placenta and you find that actually there were parasites there all along. So we're thinking about ways that we can detect malaria in pregnancy, particularly placental infection, earlier on and using a biomarker approach. So that means looking for changes that are evident in the maternal blood that indicate that there are some biological changes as a result of a parasite infection in the placenta. So their model is that when you have a malaria infection in the blood, in the placenta, that causes the release of certain maternal factors. In this case, these are receptors, fetal receptors that are on the placenta that might get released into the maternal blood and that we might be able to detect using a very rapid type of diagnostic kit that could even potentially be done at the point of care. And what we're focusing on is a specific sugar that we know is unique to the placenta and that we have evidence for that it may be released into the blood when there's a parasite infection. And that's the work that Rebecca is doing as part of her PhD. These are data from samples collected in Colombia. We have uninfected placentas and infected placentas, and we're looking at the release of this sugar into the placental environment where the maternal blood passes through, and we can see this significant increase in that sugar. So now we're looking to develop this further as a potential biomarker for placental malaria. So those are some of the projects that we've led together with Amanda. Amanda also has other projects that she's been working on for many, many years in the same communities that we work with. And so I'm just going to share a couple of slides on her behalf about those projects. She collaborates with Professor Carmona, who's an epidemiologist within their team. And again, Eliana has really played a central role in these projects. So this is just a list of some of the projects, and really they focus again on malaria and pregnancy. Amanda has been very interested in the genetics of the parasites that are infecting pregnant women, both Plasmodium vivax and Plasmodium falciparum. She's interested in the immunomodulation of infection with malaria. So what happens to the placental environment, that immune environment? How do we measure inflammation in the placenta in response to infection using methods like histopathology and ELISAs? How can we look at the effects of malaria infection during pregnancy on the response of the baby to neonatal vaccines? And that can be very important because the infection in utero is altering the immune response in ways that could have a profound impact on the newborn's response to these very critical vaccines. Also, helminths are very prevalent in the communities where we work in Colombia. So Amanda and her team have been very interested in that interaction between or co-infection of malaria and a number of soil-transmitted helminths and how they alter the immune response and to vaccines and also to the pathogenesis of malaria in pregnancy. And outside of pregnancy, Amanda's done a lot of work on drug resistance in the population, looking at the effects of different anti-malarial dosing protocols to prevent the transmission of the malaria parasites to mosquitoes, which is fueling onward transmission of the parasite. Also characterizing the genetics of Plasmodium vivax and Plasmodium falciparum. Plasmodium vivax is unique in that it can cause recurrent infections or relapses. And Amanda has led some really interesting studies of the genetics looking at what happens during a relapse infection. Is it the same parasite that's emerging from the liver? And using genetic tools to try to tease this out. So that's what we've shared a lot of research together over the years. And now we're very excited about this new program that is being led by Dr. Valencia, and she'll be sharing that in a moment, and also being spearheaded by Amanda for the maternal child health projects related to malaria. So these are new community-based projects in a particular region in Colombia called Urab, which Sarah will explain in a moment. And for our component of this program, we're interested in applying our work on malaria diagnosis and our development of biomarkers to strengthen the early diagnosis of malaria in pregnancy. Beyond that, we're also interested in continuing to strengthen these collaborations, research collaborations, student exchanges, and also finding ways where we can support capacity building in these communities. With that, I'm going to stop there, and I will pass it over to Dr. Valencia to share some of her slides about the program.
Thank you, Stephanie. Can you confirm if you can see my full screen now? Okay, perfect. So first of all, I want to thank you, Stephanie, and all the team that invited to us to be part of this event, especially Dominic as well, that has been instrumental in this cooperation between the two organizations. And we want to keep working with the university and the entire team. And that's the reason why also we are subscribing a memorandum of understanding to formalize the relation between both organizations. And I hope that through this cooperation that Amanda, Stephanie, and other professors are right now using and that we can strengthen, you can contribute to this program that I want to share with you. And that is an initiative that is part of the master plan of the Faculty of Medicine. We have 4 main pillars in this moment, but we want to translate and to implement science and technology for health development. So the capabilities that we have in the Faculty of Medicine in the urban areas can be translated in Urab. That is one of the main areas of development for Antioquia and for Colombia, and also is region in the country that needs a lot of support and has a lot of social challenges and health challenges. And just to try to place where is Urab in the map, I want you to just bring this picture to you. And as you can see here, there are a lot of immigrants routes coming from Europe, from Asia, that are coming to Latin America to travel then to United States. And many of the routes come here at this point that I'm showing you, that is Urab, that is near to Panama. And from that point, they travel to Panama to continue their journey through South America, Central America, and then to the United States. So in terms of migration, it's right now one of the key hotspots in the world and has a lot of social and health challenges, but also is an area in Colombia that represents a lot of development. And it's a new port is being developed there, and it's going to be one of the most important one in the region, not just for Colombia, but also for Latin America. And also that is going to present a lot of social, economic, and health challenges. And there are needs to prepare the health system and to adapt to all the immigrants, legal and illegal also, and the force and all the challenges into the environments that are going to happen because of the opening of the ports. So we have a region at this point that is quite important for Colombia in terms of also for global health, but also for global migration, but also for economic development. And we as a university want to be there, strengthen the capabilities of the health system, transfer and translate the capabilities that we have, not just in education, but all the results from research. So for example, the work that Amanda and Stephanie have been doing, and find ways in which that research can be then integrated and used into the health system for better diagnosis, better treatments, and to improve and strengthen the health system itself there. But the challenge is big. And as a university, we had to start to identify our main priorities. So we created like a program that has three phases in this point. Then we needed to understand the main capability, the main health conditions of the in the region, whether the diseases that are not just more prevalent, but also that have a higher level of incidence compared to other ones and has been sustained over time. So we identify, for example, that just born transmittable diseases are one of the main ones that are really high in the region, and the levels and the incidence is higher than in the departments. For example, dengue, malaria, as Stephanie was mentioning, leishmaniasis and Chagas are some of those ones. Also, we have hepatitis, some cases of cancer, leukemia, and all of the yes, breast cancer, also bacteria, like tuberculosis and leptospirosis. And the point about mental health, cases of violence against women, are highly reported, and the morbidity of maternal health, like the mortality of women, are some of those ones indicators. So we had to prioritize, and this is just an example about how the levels of dengue, the numbers of cases of dengue and malaria have been increasing over the years. And malaria, you can see here in the report. So we are quite interested in to address malaria specifically. And the work that we have been doing in trying to formulate and to prioritize the areas is not just by myself. So I want to thank publicly to Adriana Pavon. She has been working with Amanda and Guillermo Rua in Urab for a long time. Adriana works in terms of identifying new drugs, anti-malarial drugs in Urab, and identifying new species that can actually be better treatments for the conditions in the area. Dr. Guillermo Rua, he's entomologist, and he works in the management and control of vectors of different clients. And his work also includes not just Urabá, but different areas in Antioquia and in Colombia, in Cordoba. And Dr. Amanda Maestre, too, that has been instrumental and quite open and really generous in opening the collaborations and the doors for us to work with Stephanie and the rest of you there in Canada. So thank you. And they have been also working in the prioritization and working with the other research groups. So in this program, we went to the region, established direct conversations with mayors, public hospitals, private hospitals, employees, the banana plantain companies that are in the areas, schools, to understand the main needs and in terms of health, and how they could get involved into this kind of initiative or translational initiative. And also trying to identify what are the main pain points. Sometimes from the epidemiological perspective, you can see some priorities. And when you go to the territory, actually what is happening could be sometimes different. So for example, we saw a lot of indicators related with metabolic diseases and cardiovascular diseases. But when we went to the area, actually we're experiencing a lot of issues, and the indicators in terms of trauma and accidents are increasing yearly. So they need some support in how to promote the prevention of trauma, but also increase the response of emergency systems and units, and that sense enhance the capability clinically, but also articulate the entire pre-hospital network, so that can be really efficient. So that was the visit there, and now we are formulating different programs and searching for different resources and funding so that we can cooperate not just with our national government, apply for local grants, but also we are quite open and interested in to work with international partners, foundations, university around the main priorities that we have. So as I mentioned before, from the talk with local communities, with local governments, I'm using also the epidemiological data, we prioritize 4 main areas to work and to build our program around. We call these ones priority or pillars. So we have maternal and perinatal health. So the region is experiencing a high level, like a high number of adolescent pregnancies, although in Colombia, the numbers of newborns are decreasing yearly. In the region of Urab, it's not the case. And actually, they are increasing the born rates annually. And the adolescent pregnancy is one of the main challenges that they are facing. High level of maternal mortality and low childhood nutrition. Also, in terms of mental well-being, this is one of the regions that have been experiencing a lot of the violence, historical violence, for different narco groups, but also for also terrorists or other forces in the region. So a lot of mental well-being is related to that low capability, to that historical background. And also there is a lot of concerns about the mental health and the well-being of students and indigenous population. And there are high levels of suicide also in the region. And about vector-borne disease and infectious disease, there are high prevalence of different infectious diseases, as I mentioned before. And about trauma management, you can see this is actually a new road that they opened like just 2 years ago. And because of these capabilities that they have in terms of transportation, the levels of accidentality is increasing and the fatalities, and also they need to create a strategy around, and we can, with our capabilities, trying to help and support that one in the region. So who we are as a Faculty of Medicine, we have 51 research groups. 32 of these research groups actually are working on some of these 4 topics. 4 are working on mental health and well-being. 21 of our research groups are working on vector-borne and infectious diseases. Actually, that is the main capability and area of expertise that the Faculty of Medicine has. And it's where we have actually most of our main results. And Dr. Amanda, as you can see, Professor Pavon and Dr. Guillermo working in that area. Also, 3 groups in maternal and perinatal health and 4 research groups working on topics related with trauma management in that sense. So with that information, with the priorities, with the consultations, with the topics defined, we created a first encounter between researchers and local actors. So we could bring together the realities in the context to the researchers. And some cases, some of them are working in the territory, in some other cases not. And we needed to contextualize kind of these project and programs so that researchers can propose more tailored and contextualized projects, not just based on data, but also hearing local actors. So we have the Secretary of Health of the entire Department of Antioquia, people from the Pan American Health Organization and the WHO that are working in the region, attending the migrant challenge that we are facing, also local hospitals and local health providers and Secretary of Health from one municipality. So in that case, we can create this dialogue and try to create networks. So also we are emphasizing that our approach is not just from the disease and the human perspective. Also, we want to see this global concept of one health, understanding that the health of everyone, like the people, animals, and the ecosystem is so important to have an equilibrium. And also to have a better well-being for all, not just thinking about from an anthropocentric perspective. So in that case, these are some of the main challenges that we identify. I'm just going to be a little bit faster. We can talk, have more space for the dialogue. So we identify some social and cultural factors that actually have an indirect impact on the of the 4 pillars that we saw for infectious diseases. There is low contagion awareness of people, so the local practices and how people interact with the vectors, and if they know that they cannot go outside to work or to do some activities, it's part of the resistance of changing the behavior. There are some risky behaviors that can make people more prone to have a disease, and they have some low vaccination rates about mental well and well-being. As I mentioned before, domestic violence and the armed conflict still is one of the main issues in the region. Social and economic inequalities affects people's health a lot, and a lot of family dysfunctions that had effect directly to the consultation of the health services, but also the adherence of treatment and to be part of follow-up also by the health system. Sexual and reproductive wellness, like it has some different challenges there. And natural childbirth is disincentivized, so also that can lead to more maternal health because of the malpractices during the C-section. Domestic and sexual violence is still one of the main issues related with this topic in the region, and transmissible disease in the infectious transmissible disease is one also ITS in the region that we are seeing, and we are trying to identify some projects to work together. And as I mentioned, in terms of trauma, also there are low centers of promotion and prevention, and in terms of rehabilitation, the adherence is quite low. So we have different environmental factors also in the region. Potable water is not available for everyone. So still we have a lot of infections that are transmitted by water sources, and different sanitation measures and the management of water deposits or for the burns of vectors is quite difficult. Also, the high proliferation of some vectors that can be managed with some simple practices are not that easy in the region, and expansions of the forest limit. So the agrarian limit, it's also increasing to the forest. So in that sense, people is exposed more to other diseases because of this situation. And also there are a lot of neurotoxins circulating through in the area because there is a large banana plantain commerce and production organizations there, and they actually use at this age different smaller aircrafts to disperse some plant killers, and that also creates a challenge in terms of the circulation of these neurotoxins in the region. So in that sense, also we saw some challenges in terms of access to health services, geographical and economical barriers. This is a rural area, it's not an urban one. So access, it's difficult because people have to deploy to travel to the urban areas. They don't have the economic resources for that, or to pay also. In some cases, the secondary or tertiary health level or specialized level, it's far away, so they can access to the primary care level, but they cannot continue the treatment because of also these barriers. Also, the insurance system is quite fragmented in Colombia, and specifically in this area. So there is not a really well governance about the patient in terms of how to follow up the patient through the system and to the access to the different specialized specialties and levels of complexity in which they need some attention. So think about a cancer patient that has a cervical screening, is positive, and how is the process to access to a really specialized diagnosis, and then the treatment, the follow-up, and the discharge. And in that case, the insurance system and insurance provider is the one responsible to guide the person through the different steps. And that is not the case. So we need to work on that. And that's one of the main challenges. Also, immigration status and the stigmatization and discrimination of different populations, specifically, as I mentioned in here, in terms of indigenous people, Afro-descendants peoples, and migrant populations. They are the ones facing the main barriers to access to services. And because they have not just economical barriers, but there are also cultural barriers to access to the service, and to invite them and have like actually cultural relevant services for many of them, especially for indigenous communities. There is a lot of work that we need to do in that sense. Also, as I mentioned before, the insufficient integration between the different levels of care and the low adherence of the different guidelines and services, especially for maternal care. And there are also different situations in terms of rehabilitation. And also we saw that in terms of human capital, we are a university, we receive a really high level of demand from local actors to train people, to improve their capabilities, and to not just train nurses and general doctors, but also to create programs to specialize the health professionals, and also that we can have more research and that they could have a professional advancement in the region. So that is some of the challenges that people have in that sense of training, that they need a career as well, but also because we are talking about a remote area for some professionals, there is no really good incentive to be there. So there is they have a large turnover of human capital. So they need to recruit usually a lot of people, and they need that human resources hotbed to be recruiting the people that they need, and the doctors, nurses, and all the professionals that require, social workers, for some cases, physiotherapies, among others. So in the program that we are formulating, the idea is to integrate the different capabilities that we have and to enhance and to strengthen the health system in Urab, and to tailor our capabilities to their needs. So in that sense, we are here, I'm just going to mention some of the main lines of projects that we are right now working on to work with the communities and with the health providers and with the governments, and in which we are aiming also to look for funding, to train researchers and to publish. So in the terms of the maternal and perinatal health, we want to strengthen the maternal health care roots in Urab. Actually, the University of Antioquia is really well recognized, not just in Colombia, but also in Latin America, for the creation of the Red Code. That's a strategy to address an emergency, to decrease the mortality, and to have a better management of the women and the baby, and to decrease that risky situation. And they have different red flags and have a really good protocol, and they enhance and they work on the entire route. So there is a strong expertise in that sense, that we want to work with them and the local communities, and also working with the hospitals. Also, that includes training of the human talent in health. Also, we want to strengthen the diagnosis of risk of hypertensive disorders associated with pregnancy in the region of Urab. Some of our researchers actually are doing quite good and a really good work in that sense. And they have different protocols that are actually showing the implementation of some alerts, early alerts before the 20 weeks of pregnancy, that can actually improve the development of the pregnancy and decrease mortality. And also implementation of a screening for sexual transmitted infections in the Urab region, and identify new molecular markers that can increase the diagnosis and the management. In terms of maternal health and well-being, we are proposing a study of social, environmental, genetic, and biomarkers, and the biomarkers determinants to improve the diagnosis of neurodegenerative and mental diseases. Also, the development of new diagnostic tools for mental disorders and neurodegenerative diseases. And also, in this case, strengthening the capabilities of the human talent. And we are quite strong in working on telemedicine and telesupport. And we are proposing, because they have a gap in the number of specialties of psychiatry, for example. They have a big problem because they don't have the psychiatrists in the territory to attend the demand. So we are proposing to the capabilities that we have here in a center that we have, that is the Living Lab, that is the official name, support and to work with them, with the professionals in the area. And also, this is a really we have a strategy to work on the brain health of the elderly people and how they can keep the cognitive ability. And also it's quite important to provide care for the caregiver. So we have also some initiatives in that sense. About vector-borne and infectious diseases, one of the main areas is to strengthen the epidemiological surveillance of some of these diseases in the region. We have different here strategies. Oh, sorry. Also, we are working on identifying new biological and physical ways of control vectors in the region. Wolbachia, that is the release of some mosquitoes that have this bacteria, have been proved that can be effective for the control of dengue diseases, for example. So those are kind of the capabilities that we want to transfer there. Also, the development of phytomedicines based on native plants, like the work that Adriana is doing, can be part of this program, and we are thinking about how we can support that. Also, better diagnostic tools and identification of molecular biomarkers. The work that Stephanie and Dr. Maestro have been doing is in this main area here, and also how we can do better clinical trials for vaccines and diagnostic tests of medical devices in the region, and how we can work on the social appropriation of knowledge. And in the terms of trauma, also we are proposing and working on observational studies to characterize the risk factors and the occurrence of trauma in the region, strengthening the capabilities also in terms of the promotion and prevention and the integration of all the different actors that need to react in terms of when a trauma or an accident happens. And now that the ports are going to open, also how can we work directly with the ports to decrease the risk of the accidents and work with the health of occupationals, so different professionals that are there. And also how we can manage better patients in the emergency unit, and the protocols and different models that different researchers here have been created can be implemented in the region, and also can strengthen the different procedures and the training of doctors and different professionals in the area. And also we are proposing a patient rehabilitation program. We are opening a new physiology program in the for the faculty, and physiotherapy program as well. And the idea is also to have there an ambulatory unit to offer a rehabilitation to the patients, because that is something that actually it's not in the regions. And these are some of the transversal lines, but I just want to close this intervention talking about the potential alliance. As Stephanie was mentioned, we are quite interested in to work with different researchers and organizations to build the capability of the organizations of the people that are in the territory. Also, we are quite interested that this program and these different projects also can help to train health professionals. We as a faculty of medicine wants to create a medicine program in Urab. So we are in Medellin, we are training professionals here, and then they go back to the territory. We want to train them there and create also capabilities in the region. And we can do this also in a cooperative way, also with international universities and organizations, but we want to actually build the capabilities locally. And we want that this program can help us to have master students, but also different clinical specialties from professionals in the region to be trained in the region, so that they can also in the future be also professors from the university in the region, but also can be work in the health system with the different organizations there. Also, we are quite interested in training interprofessional educations. We are the Faculty of Medicine, but this program is not possible just for doctors and with doctors, and we need to work with the entire network of actors that are there. And also we are aiming to increase our academic and research mobility, to also learn about others, and others can learn from us. And also we are quite interested in to have a continued monitoring and evaluation program to identify these new health interventions that we are aiming to translate into the region, the training programs, the new diagnostic tools, the new protocols that we are aiming to introduce, or the strengthening just for the capabilities of a unit. Actually, what is the effect? And we are quite interested in to use some of the elements of the implementation science to evaluate and monitoring how successful is this program in the territory, and being able to evaluate if it's the intervention of it's also the impact that the context will have on the interventions. So this is about us. Thank you for the time. Thank you again for your invitation. Thank you for listening and to be with us. And we are more than happy to keep going and to keep this communication with you and to identify collaborative opportunities between both organizations. So thank you once again.